We have with us Mr. Sreeni Venugopal, Group CIO and CXO of KIMSHEALTH. Mr. Sreeni is a C-level executive in the field of cybersecurity and technology management. He has 28 years of diverse global expertise covering executive leadership, IT strategy, technology solution. He has got hands-on experience across the entire cybersecurity spectrum from security strategy, governance, risk, and compliance. He has worked extensively with CXO level stakeholders to protect IT systems, ensure compliance, reduce cost, and achieve business benefit. He has successful track records delivering multi-millionaire dollar programs as well as high impact niche programs. Thank you. Thank you so much for joining, sir, and a very warm welcome.
Thank you, Urmi, and thank you for having me.
The healthcare industry has been rapidly evolving in terms of digital transformation and the use of technology. How is technology playing a key role in enhancing patient care and operational efficiencies at hospitals?
Thank you, Urmi, for that question, and I think that's a very relevant question because I have worked across a number of domains, including banking, transportation, manufacturing, before moving to healthcare, and it has been my observation that the in healthcare has been less or limited compared to the other industries, and I see that it is changing, and there is a lot more focus and usage. Particular to healthcare, I see that those are some areas where we work in. One is the usage of artificial intelligence for diagnostics, particularly in the radiology space, and where we use artificial intelligence and machine learning to look at radiology images and predict the probability of medical condition. And that makes the job of the radiologist very easy in order to either find out if a particular X-ray or CT is normal versus whether anything is abnormal. Abnormal, why is it abnormal? Where is it? In what part of the CT poses a problem? There is usage of technology for patient safety. Very recently, in our hospital, we launched a IoT-based solution for tracking surgical sponges that are used during patient surgeries, because the risk of a sponge being left inside the body of a patient was quite high according to global standards, and that could even cause death of the patient. And so we have a technology solution that tracks these sponges before and after the surgery to make sure that patient safety is ensured. Multiple other technology solutions in the IoT space. Sensor technology is used very extensively in healthcare now, both for clinical applications like the surgical sponge example that I talked about, for tracking of surgical instruments during surgeries, to tag and track newborn babies in the hospital to ensure that babies are not stolen from hospitals or not separated from their mothers, geofencing of hospital equipment. On the administrative side, we can track patients as they move through the different parts of the hospital, as well as track our assets in the hospital. Again, the technology plays a big role there. Finally, a very important area which I am quite passionate about is augmented reality and virtual reality. So in the hospital space, there is a great use case for using augmented reality, virtual reality for post-operative patients, for elderly patients who and who need this sort of environment for rehabilitation. And there is great application for AR, VR, and rehabilitation. So those are some of the uses of technology, but there is a lot more, of course, in the healthcare space.
So data is a huge thing in today's time. Data security and patient privacy are critical concerns in the healthcare sector. So what measures are healthcare institutions undertaking to protect patient data and ensure compliance with relevant regulations such as Healthcare Insurance Probability and Accountability Act?
Right. HIPAA as such is not applicable in India, but it is very relevant because most of the clauses and the guidelines provided in HIPAA are for good management of patient data. And so most hospitals, including ours, are aware of it, and we put in measures to protect patient data from these kind of breaches and issues. healthcare data has been tagged by most countries as either sensitive personal data or very critical personal data, and therefore the kind of security measures that you have around that need to be that much more stringent. From our hospital perspective, we have a very isolated network for all of our hospital systems, which means that nobody else from the external world can connect into it. That's one way of physically making sure that there is a certain amount of physical segregation between the systems in our hospital and the external internet. The usage of encryption extensively is also recommended. So even if there is a data breach and data does get out, then we are not really exposing unencrypted text information about patients. Resilience is a very key area when it comes to data protection, because ransomware attacks are quite prevalent in the industry now. We need to make sure that there are immutable backups that you can always fall back on in case of a breach, having it like live failover and such kind of mechanisms. From an administrative standpoint, in order to ensure security and secure access of patient data, we use role-based authentication within our hospital. So only people who have a specific need to access patient data are allowed to access such data. So even if you look at the clinicians accessing patient data, not all the doctors can see all the patient's data. A doctor can only see the data of his or her own patients only for the duration that the patient is admitted or consulting the doctor. So we make sure that there are quite stringent restrictions in place that prevent the unauthorized access and usage of data. And even if there is a breach, we make sure that such breach data is unusable either through encryption or other means.
Okay, so we would like to know, how do you balance the need for data security with seamless access to patient information for healthcare professionals?
That is always an uphill challenge, right? Because I am both the group CIO and the group CISO here at KIMSHEALTH, and those are two conflicting job responsibilities. As a CIO, I have to ensure fast access, quick response, availability of systems, and as a CISO, I have to make sure that systems are secure and not subject to breaches. And therefore, the application of security mechanisms usually have a result on the technology side where the systems are not as usable as the doctors would want it to be, because people would like to have 4-letter passwords. People would like to have share their access with other fellow clinicians, but that is not good practice. And therefore, when you balance the need from a technology perspective for healthcare professionals, from a security perspective, that is always a delicate in a situation to be. But the way we do that is through training. So we ensure that healthcare professionals understand why there are certain security mechanisms in place, why are there certain restrictions that make things a little more difficult for them. But at the end of the day, those are to ensure that the clinicians are safe in terms of what data they expose, and also our patients are safe in terms of how their data are protected with the organization.
Thank you. So, COVID has changed our lives completely. The COVID pandemic has accelerated the adoption of telemedicine and remote healthcare services. How has KIMSHEALTH hospitals leveraged the technology to provide virtual healthcare services?
Yeah, so thanks, Sreeni, for that question. And you're absolutely right that the COVID pandemic brought in a great change in how technology was adopted in the healthcare sector. So in fact, there was as much technology adoption in that year of COVID as the whole last decade of technology in healthcare. So great acceleration, great benefit for tech in healthcare. As with any other hospital in either India or elsewhere, we also leverage technology to remotely treat and allow our patients to have consultation. So Teleconsultation was one of the biggest offshoots of technology adoption during COVID. It allowed the clinicians to directly see the patients on video, have a proper discussion with them, and be able to ascertain their condition and prescribe medication. But again, the Indian government has released very comprehensive guidelines on what can be done during teleconsultation and what can't be done, and for good reason. So there are certain drugs that can be prescribed, some that cannot be prescribed, certain ailments that can be treated remotely, and some that needs to be treated face to face, right? So keeping those restrictions in place, teleconsultation was very successful. We saw a huge increase in the number of teleconsultations that we did during a day during that time. In fact, all the follow-up consultations for COVID patients were done by teleconsult, because there was really no need for them to come into the hospital unless they had a severe symptomatic attack. So that is one of the things. The second thing that we did during COVID time was tele-ICU. One of the greatest challenges in the healthcare side is the lack of good ICU doctors or intensivists in remote locations. So having a tele-ICU solution allowed intensivists in our home base, in our main hospital, to support the ICU admissions for COVID in our smaller remote centers. So the whole restriction of geography in providing healthcare services were eliminated, and so that was another way in which we were able to bring in technology during COVID. Tele-triage was another service that we offered, where patients who needed emergency services could call into our hospital, and a panel of doctors would go through their symptoms, their condition, and triage them and suggest what were the next steps to take. Do we need to send an ambulance to their home, or were they okay to be home and be under home care? So those are some of the things that came up. And lastly, home care was a solution that was launched during the COVID time, where the healthcare professionals and the whole mechanism would go to the home of the patient and deliver health services.
So as you just mentioned that telemedicine in the remote area has given an opportunity for treatments. So what do you think, what's the impact that telemedicine had on patient outcomes and access to healthcare services?
Yeah, so number one, access to healthcare services has improved tremendously because of tele services. So it could be accessing healthcare services sitting in the comfort of your home. An example I will give you is our hospital is located in Kerala, where a lot of the working population is outside of the state, either working in the Middle East or somewhere, and with aged parents in the city. So when they need to consult a doctor during COVID time and they're on teleconsultation, their family or loved ones would join remotely, sitting anywhere in the world, right? So you could actually bring that whole family together in a consultation with a doctor, and that really improved the trust and the outcome of our treatment. That said, there are certain kind of treatments that cannot be prescribed over telemedicine. You need the doctor to be able to see the patient, touch, feel, and make a judgment based on physical examination. So in those kind of cases, the patient would invariably have to come into the hospital. So for anything else, it has made a big change in accessibility to healthcare.
How are hospitals addressing the interoperability challenges and ensuring seamless sharing of patient information and across the healthcare network, wherein we know that interoperability and data exchange among different healthcare systems and providers are essential for delivering comprehensive and coordinated patient care?
Right. And that is a very good question, because usually hospitals tend to work as silos, where we have our set of patients, a different hospital has a different set of patients, and usually the responsibility falls on the patient to carry their medical reports and diagnostic papers from hospital to hospital if they are consulting different clinicians in different hospitals, right? And one of the reasons for this is because the hospital wants to protect their patient base, but is also because of security, because you really do not want to open up your medical information, among other things. It is a platform that allows hospitals to connect to the government's national network, and that platform will facilitate the sharing of data between not only the network hospitals from one hospital to another. It will also facilitate the sharing of patient information from hospitals to insurance providers. That will kind of digitize the whole ecosystem and allow interoperability and data sharing. Having said that, it is also important to note that ABDM brings in another big change, which is putting the power of handling that data in the hands of the patient. So the patient is the ultimate owner of his or her health information. And through this platform, the patient can decide what information to share with which hospital and which insurance provider. So that kind of flexibility will come in. A few other things perhaps to talk about interoperability is that even outside of ABDM, hospitals do share information, especially when you are working with third-party service providers who provide, for example, AI-based diagnostic services. So you could be sending your radiology information to a third-party provider who will use an AI-based analytics software to analyze the CT or X-ray and send you back the outcome of the reports, right? So in that kind of cases, then there is always a ecosystem or a mechanism, a secure mechanism for sharing that data. Overall, it's the security of such information sharing that makes it difficult to open up our systems so much. So ABDM, I believe, will be a game changer in the ability of hospitals to share information and with the providers.
So, with evolving technology and so much talk on artificial intelligence and machine learning that are transforming various industries, including the healthcare sector, in what ways are KIMS Health harnessing AI and machine learning technologies to improve diagnostic accuracy, treatment outcomes, and overall patient experience?
This is an area of great interest to us. As a hospital, we have been completely digitized as a 100% EMR hospital, electronic medical records, for the last 20 years. So, which means that we do have a wealth of information about patients, demographics, clinical conditions, treatments provided, what medications they took, what kind of ailments they saw progressively during their treatment cycle, and so on. And we believe that that data can be put to good use using artificial intelligence and machine learning, especially for predictive analytics of the probability that a particular patient can develop a certain health condition in the future, which then allows us the ability to intervene early, either in terms of wellness solutions or intervention where the patient should take to prevent such conditions, or how we can provide treatment early on and to reduce the intensity of any future medical condition. Right? And that's a very powerful tool because you can actually use data and with analytics and machine learning to come up with these kind of predictions and such. That's one of the areas that we are looking at. In the diagnostic space, especially in radiology diagnostics, CT and X-rays, we use AI and machine learning through a third-party provider in order to analyze our images. And usually what the AI software does is it very easily finds out if a particular X-ray or a CT scan or an MRI is normal, abnormal, or the AI is not sure. So it will classify it into three buckets, saying that this is a normal X-ray. Here is an abnormal X-ray. It's abnormal because ABC. And these are the areas in the X-ray where an anomaly is seen. And three, it says that this could be either. In any case, a radiologist will take a look at this. It will corroborate what the AI software has said. But it then makes the job of the radiologist very easy to go in. And if it used to take them 10 minutes to do something earlier, now they can do that in a few minutes. Right? So productivity increases, accuracy increases, and so on. So that's another area where we can do that. On the administrative side, we use IoT technology to track our shifters, which means that patients are being shifted in the hospital in a wheelchair from location A or from an inpatient room into radiology or for an ECG. Then we are able to track the movement of the patient. And using AI, we can actually predict how long it would take for a patient to we move from A to B. How long will it take a patient once he or she wants to move to be attended to and so on. So and again, we use data analytics for that. So a few different areas. And I think there is a lot more that can be done with AI and ML. Again, we as a hospital, we don't try to do all of that ourselves, but we try to work with academicians as well as startups to bring that technology to our hospital.
With this dynamic technologies coming up, in time we have also seen cybersecurity threats in the healthcare system have been on the rise. So, with the hospitals being targeted by ransom attacks and data breaches, how do KIMSHEALTH hospitals stay ahead of emerging cyber risks and protect sensitive patient information? And if there is any specific strategies or best practices you have been implementing to mitigate such cyber threats?
Yes, and health data, like I said before, is extremely personal, very sensitive, and if you look at the data that is sold on the dark web, healthcare data fetches, I think, 5 or 6 times more than banking data. So you would have to pay, or a cyber criminal will get 5-6 times more money if they breach into a healthcare institution rather than into a banking institution. And that is because healthcare data is permanent. So you could, if you lose your credit card information, you call the bank and say that I lost it, and then they block your card and you change your card. And then your loss is limited to that duration when the card data is exposed. But if you lose your biometrics or if you lose your health data, it is irreversible and it is permanent. It doesn't change. So which is why that data becomes very, very important. And so there is a accountability on us to protect it. So one of the biggest things that I usually say when I'm asked is cyber hygiene. Usually people do talk about high-end tools and automation and such, but I think that the most important thing is cyber hygiene, ensuring that you have proper backups in place, and that you conduct these restoration drills and make sure that your data can be restored. Because however much you try to prevent an attack, you cannot be 100% sure. So some point in time in the future, you could get breached. And if you get breached and your data is encrypted, you're hit with a ransomware attack, you need to have a foolproof mechanism to come back online, because otherwise your operations are impacted. As a hospital, you cannot afford to have your hospital information system down, because then the clinicians cannot access patient data and cannot do surgeries, they cannot provide care, and that could lead to really bad medical conditions, death of the patient, and so on. So having proper cyber hygiene backups in place so you can restore from an attack is very important, and that's one of the best practices that I would suggest. Very simple too. Resiliency of operations, making sure that you have a way to either in terms of having live setup. So if you are breached, then you can immediately, if you go down on one side, then you can always come back up on another site and continue your operations. Of course, you need to have the right tools in place, like CM tools for detection, for response, have a right cybersecurity team. If you are a smaller hospital or a smaller healthcare organization, I would suggest that you go for a managed security service, because that would be much more easier to leverage the capability and the technology and the expertise of an external provider rather than try to do it yourself. But you, of course, need to have a cybersecurity monitoring and response mechanism in place. Lastly, we are great believers in open source. We do a lot of exploration analysis ourselves in the implementation of open source cybersecurity tools as an add-on to the general corporate tools that are in place. So I would really suggest that more and more organizations need to explore that, because there are some really good tools out there that you can use to have a secondary mechanism for cybersecurity and cyber resilience.
All right. So we would love to hear about the tech focus areas and priorities over the next 3 years.
Okay. So from a healthcare technology standpoint, we are looking at predictive analytics. Like I said before, we do have a wealth of data of patient conditions and demographics from 20 years. So we are putting together programs to analyze that and apply AIML to get some predictions out of it. Another key area of importance to us is the usage of IoT, Internet of Things, sensor technology for both clinical applications, as in patient safety, like the surgical sponge initiative that I spoke about, but also for operational efficiency, being able to track assets, people, and for example, we are tracking the movement of blood samples to the hospital. So those kind of things, being able to track assets and people across hospitals. We are quite focused on the automation and interoperability, because ABDM is coming up in a big way, and we want to ensure that we are compliant and connected to the national network. We are looking at the usage of cloud quite extensively, because cloud is usually not used as much in healthcare as compared to other domains. So we really are looking at how we can leverage cloud in our space. Telemedicine is another important key area of importance to us, and which we are looking at. That's from a technology standpoint. From a cybersecurity standpoint, we want to strengthen what we have today. So a key area of focus for us is to ensure that we have the right tools and techniques in place, and we are trying to build a team ourselves, which will look at offensive security to ensure that we try to breach ourselves and find out vulnerabilities before somebody else. So those are some of the key priorities for us for the next 2 to 3 years.
With that, we come to the end of this session, sir. Thank you so much for sharing such insightful knowledge and joining us. Pleasure meeting you. Thank you, sir.
Thank you, Umi, and thank you for having me. Always a pleasure to be talking to you and to CXO TV. Thank you.
For more updates from CXO TV, please like and subscribe to our channel.